Hello, I'm Louise with Gayle today, and we're talking about her experiences with reduced kidney function. So Gayle, I'd like to ask you, how did you first find out that you had reduced kidney function?
Well, my story goes back before that. 11 years ago, I donated one of my kidneys to my youngest sister. And the surgery went well, and she's doing fine. And as a result of the surgery, I had follow-up appointments. So about 5 years after the surgery, my, what they call glomerular filtration rate, or GFR, was starting to decline. It was like in the 90s after the surgery, and it started to decline. And once it hits 60, you technically have kidney disease. So it started to decline, and every 3 or 4 months when I did a blood test, it continued to decline. So I thought, okay, maybe I need to quit work for 6 or 9 months, just do away with the stress, try and eat very healthy. And mind you, in order to donate a kidney, you have to be healthy to begin with because they run you through all sorts of tests. So I was healthy. But even after retiring from work, my GFR continued to decline. And so now I started to be tested for different things. And finally, a biopsy was done, and I was diagnosed with a rare blood disease called amyloidosis. And what this blood disease is our body produces protein, short and long chain protein. And what I'm told is that it pairs up and it goes through our system. But my body was producing excess of one, and it didn't have the buddy to pair up with. So that excess protein was dumping into my one remaining kidney and caused my kidney to fail. So that's when I was told that I would have to go on dialysis.
Was that something that you had to do immediately, or did you know there was some time to make plans?
That's when I think most people, I've been a part of a support group that most of us go through denial. And I guess for me, because, I was healthy, I donated a kidney, and I thought, how can this be happening? So as my GFR continued to decline, my doctor says, well, you will know when you have to go on dialysis when you start to feel nauseous and want to throw up. Because he says the body's not filtering the toxins. Yeah, and your GFR can decline, to 15, 10, 5. I let mine go till like 5 because I guess that was kind of being in denial or hoping, that wasn't going to happen. So one day I called my doctor and I said, oh, I feel like throwing up. And that's when he said, okay. So I had to go to emergency, and they install a catheter, and that's for emergency dialysis because they can pretty much use it that day or the next day. At the same time, the surgeon installed the fistula, but this requires 6 to 9 months to mature before they can use it for the dialysis. So in hindsight, if I had to do it differently, I probably would have had the fistula installed sooner, give it time to mature, and then pretty much use that for dialysis versus the catheter. I mean, this is pain-free pretty much when you're doing dialysis because they don't have to poke any needles in you. They use, the catheter. But you cannot get it wet or it can get infected. So it's difficult when you're showering, trying to wash your hair.
I imagine.
Yeah. So if I had to do it over again, I would have had the fistula installed sooner so that the time using the catheter would have been minimal or not at all, and then could just use the fistula.
So at that time, were you seeing a nephrologist, or was this just your normal doctor?
No, I was seeing a nephrologist because I was a kidney donor.
Okay.
Yeah, so for follow-up visits.
Okay. And Did you get help about a healthy diet for chronic kidney disease?
If I recall, it wasn't readily available. I asked my doctor about a dietitian, and I was told unless you're a dialysis patient, they have dietitians for the dialysis patients, but very few dietitians available. So it's basically doing my own research. The National Kidney Foundation here has some information on what you shouldn't eat if you're pre-dialysis or once you're on dialysis. And you can go online, there's websites that will help you as far as what basically we have to watch our phosphorus and our potassium intake. Those two things, when you're on dialysis, your body is not processing well. So, I have charts of foods with phosphorus content and foods with potassium content, and it lists foods that are high, medium, and low in those. So the ideal is to stay with the low potassium and phosphorus content foods.
Okay.
Yeah.
So early on, you had to seek out nutrition information yourself, a good diet on your own. Yes. And even after getting those charts, and I looked at it, and I remember going grocery shopping one day, and I thought to myself, why bother? Yeah, I get it.
But
so
you
many
learn
good
to
foods.
adapt.
Yeah, and foods like bananas that everybody thinks
Is healthy
are
for you,
healthy.
right?
Yeah.
Or even oranges.
Yeah.
Are high in potassium, so you have to limit. So, and we all take phosphorus binders, which basically helps to pull any excess phosphorus out of our system. So that helps.
I think you said it was 5 years post kidney donation that you first started seeing reductions in kidney function. So how long was it from then to going on to dialysis?
Within a year.
Oh wow, so that's fast.
Yeah, because it just kept declining, and so I've been on chemo because there's currently no cure for amyloidosis. So I've been on chemo to control the production of that excess protein. 2 different types of chemo, and currently I'm on an antibody right now, which actually seems very effective. What it does is it seeks out the amyloid protein, latches onto it, and then pulls it out of the system.
Nice.
Yeah, and so there's minimal side effects. The other chemo that I was taking, there was some nausea, vomiting, some hair loss, but with this one, it's basically just feeling a little tired, the energy.
So it sounds like you spend a lot of time keeping yourself healthy.
Yes, and I think that's what's important for dialysis patients to realize, is that some of them might try and cheat the system. Like, we get blood tests at the beginning of every month to check our phosphorus level, our potassium levels. And some of them, after the blood tests, then they'll go and they'll, drink Coke or, eat foods that are not really healthy for them. But I think if we try to maintain a healthy diet while we're on dialysis, then it supports the whole process.
Essentially went into emergency dialysis.
Yes.
So the catheter was the only option available to you at that time.
And you'll see a lot of patients that come into the dialysis center that have the catheter. So I think, either for them, whatever their situation was, it was urgent. It's not like it was well planned out,
Okay. And I know some people are on peritoneal dialysis, which they can do at home.
Yes.
And it sounds like that wasn't an option for you.
Initially, they tell you that there is that option, and I had actually decided to do that. This is where you do dialysis at home. You do it every day. It's about an 8-hour process, and most people do it in the evening when they're sleeping. So I had decided to do that, and then right before I was to start, my nephrologist called me, and he said that there was a shortage of the fluid that is used for the peritoneal or PD dialysis, and so they were not accepting new patients.
Oh, wow.
So I had to go with the hemodialysis. But he also said, because I had donated my kidney and I had a scar, he said that there wasn't a guarantee that the fluid would flow through if I had scar tissue.
Mm-hmm.
So if I had decided to go with PD and it didn't work, then I would have to go through hemodialysis. So at that point, I was a little tired of being cut open and poked so many times. So I said, okay, let's just go with the hemodialysis. Yeah.
Okay. Yeah, it sounds like you've had somewhat bad luck in all of this. But you look like a survivor.
Yes, I guess, there's no other option. I mean, I guess it's important for the dialysis patient to choose to live, because if you go without dialysis, say for a week, then you'll basically die because of all the toxin buildup, yeah. And, seeing other patients, like there's one patient that he's been on dialysis, he's had a transplant, back on dialysis for like 30 years.
Wow.
So that gave me hope that I
Yes.
could live 30 years, if I had to on dialysis. Yeah.
What's the experience like the first time you had dialysis? So I assume you get the catheter inserted. Do you then go to a dialysis unit?
Yes. I remember walking in and they thought I was a nurse. I said, no, I'm here for dialysis. So, and like I said, with the catheter, it's pretty much pain-free because everything's hooked up to the catheter. But after that first dialysis session, at the end, I remember standing up and I started to throw up. So I'm not sure if they removed too much fluid, because that's what dialysis is. It's a very careful balance of how much fluid, they remove. So that was sort of scary because I thought, oh my God, I can't be throwing up after every session. But that hasn't happened since.
And so now you say you view it as a part-time job.
Yes.
So what do you do in that time? What's the experience like now?
Well, chair time it started out, about maybe 2.5 hours, and they built it up to like 3.5 hours and 4 hours. And then about 6 months ago, I asked if I could have it reduced to 3 hours and 45 minutes. So, but from the time they hook you up and take you off, it is about 4 or 5 hours, 4.5 hours. So that's why I view it as a part-time job. I'm expected to be there at a certain time,
right.
And to show up regularly. And so we have, each of us has a TV, and that's pretty much our lifeline. Or you can bring your iPad. I'll bring the newspaper. I'll bring word search puzzles, and inevitably you fall asleep. During some of it, most of it. But the TV is definitely our lifeline. So when the TV's not working, it's very difficult, yeah.
So do you have full range of motion with both arms when you're in the chair?
No, you have to keep the arm with the needles straight. Yeah, and then I can do things with my right arm.
Okay.
And basically the fistula is put into your non-dominant arm.
Okay. So I've heard also that they keep the dialysis unit cool because basically it's safer for the people on dialysis. So From the little I've seen, it sounds like everybody's under a blanket and really quiet watching TV.
Right. You bring your blanket, socks, dress comfortably. Yeah.
So how long have you been on dialysis now?
5 years.
5 years. So that's quite an accomplishment.
Yes, I guess I never had any sense of how long, knowing that I could be on for 30 years. But more recently, I started to look into transplant. And again, because of the amyloidosis, my situation is a little different.
Right.
When I was first diagnosed with amyloidosis, I was told by my nephrologist that as long as I had it, I was not eligible for a transplant.
Really?
Yes, their concern was that the amyloid protein would dump into a transplanted kidney, so it would be sort of a waste. But recently I attended, Queens has several classes during the week for transplant education. So I attended one of those, and I was told that if I wanted to again inquire about a transplant, my nephrologist would have to give a referral. So fortunately, he did give a referral, but unfortunately, again, I was declined by the Queens Transplant Department. Excuse me. And their reason was that they weren't sure how the anti-rejection medication would affect the amyloidosis. Because once you get a transplant, then for the rest of your life, you need to take the anti-rejection medication.
Right.
Yeah. So, but the antibody treatment that I've been on was actually prescribed by Stanford Medical Center a couple of years ago. And so I've been going to Stanford for follow-up visits, and the last time I was there, they told me I should speak to someone in their transplant department. And so I mentioned, oh, well, what about my amyloidosis? And they said that doesn't necessarily preclude you from getting a transplant. Now, Stanford is only one of a handful of medical centers that specialize in amyloidosis, because it's such a rare disease. So I thought, okay, before I pursue that, then I would check with Queens here. But now that I've been declined by Queens, I'm going to speak with someone at the Stanford Medical Center. Yeah.
They certainly have resources and capabilities.
Yes.
Because they're a teaching institution. They're so well known, so well respected.
And also, for other dialysis patients, UCSF is developing a bionic kidney.
Really?
Or artificial kidney. It's supposed to be the size of a coffee mug, and it would be implanted. However, they're going through clinical trials, I think now or early next year, and currently it's an external pack as they try and figure out how to charge the battery for it. But they have a lot of people interested in the clinical trial, so that's
of course,
good.
yeah.
And I also read that UCSF, I believe, has figured out a way how to use pig organs for transplant. So for kidney, I believe liver and pancreas, that they figured out a way how to make the body not reject the organ. So that's a possibility too. Yeah.
It's an exciting time. Technology always advances. What have you learned from the experience of being on dialysis in terms of what it takes to stay healthy, what works for you, what doesn't work for you? Have you seen other people sort of crash and burn because they didn't take care of themselves?
Well, there are times when I thought, I tried to live such a healthy life prior to the kidney donation. I exercise, I try to eat balanced meals, and I thought, so how could this happen to me? But on the flip side, I thought, if I didn't live such a healthy life, then I probably would be worse off now. So I guess that's the incentive and the motivation for me to continue to, eat healthy, pretty much as organic as possible. I try and cook more so I know what goes into the food. Unfortunately, I haven't been able to exercise like I used to. I don't have quite the stamina, but I do have access to a pool and a gym. So, and sometimes I'll just do my little bit at home and thinking, okay, every little bit counts.
It does, yeah.
Yeah, and I try to take the stairs when I can. I walk downtown to get my prescription. I walk to Queens for medical appointments. So,
what advice do you have for people with chronic kidney disease who aren't yet on dialysis and people who are on dialysis?
Well, for those, I guess, who are not on dialysis, I think they probably, unless it's like some sort of disease that I have, they probably have the best opportunity to help themselves by eating healthy, exercising, all those things that we're told to do.
That we never do.
Eliminate sugar from your diet, so that you can avoid chronic diseases like diabetes or hypertension, because those are the two leading causes for kidney disease. Yeah. For those that are on dialysis, I think a positive attitude helps, and you have to be your own advocate and do your own research. My nephrologist nurse comes to the dialysis center, several times a month. So if I have questions, I ask her. We have a dietitian that reviews our blood results. So, she'll question as far as what we're eating. And then I'll ask her if I have questions about any particular food or, So I think, being your own advocate and using the resources, of the internet, of course, reputable sites.
Okay, so you mentioned you had a fistula made. Can you tell us what that is, how it works?
Okay, so the fistula, I believe, is the surgeon connecting the veins, taking the blood to and away from your heart and making it into one. So when they insert the needle, it's just this one vein that they insert it in. Yeah.
And why do they need to do that?
Well, one needle removes the blood and it filters and processes through the dialysis machine, and then the other needle returns the blood.
And they can't use just your vein to do that?
They are using your vein, but the two veins are joined as one so that the needles are put into that one vein.
You mentioned the catheters in your neck, and you need to be careful to keep it dry. So it sounds like it's something that's visible to everybody?
It's external outside of your upper chest, and my understanding is that it leads directly to your heart.
Okay. Yeah.
And so there's this external sort of tube, and the technicians attach the dialysis tubes to it.
Okay, so that's why you need to keep it clean and dry, because it's the entry point to the inside of your body.
Yes.
Okay. Thank you so much for sharing your experience with
sure,
me.
my pleasure.
Okay.